everybody. We are the Complex Gait and Singing Variability Group from Iowa State University in the Alternative Medicine and Music for Parkinson's Disease Lab. I'm Blythe Guyman.
I'm Autumn Tedens.
And I'm Blake Staten.
And we would like to recognize our mentors, Braden Broxus and Dr. Elizabeth Steckmuller. So our study is based around Parkinson's disease. So what is Parkinson's disease? This is a disorder of the central nervous system caused by death of dopamine-producing cells in the basal ganglia, which you can see to the right here in this image. And then this is the second most common neurodegenerative disease behind Alzheimer's disease. So symptoms of Parkinson's disease include tremor, muscle stiffness, impaired balance and coordination, freezing of gait, depression, issues swallowing, and speech difficulty.
So our study focuses on the relationships between Parkinson's disease, gait, and singing. So gait describes a person's walking pattern, and this is the phases of a normal gait cycle. So gait and balance impairment are major symptoms of Parkinson's disease and can significantly impact functional mobility and quality of life in persons with Parkinson's disease. The benefits of Parkinson's disease medications for gait and balance impairment are in question. So pharmaceuticals such as carbidopa-levodopa can aid in improving gait, but they don't eliminate symptoms, which is why we decided to focus on it. So there was a study by Mozeni that found that singing provides many benefits for people with PD, such as voice intensity, frequency range, and jitter and tremor of speech. There was also a study by Dr. Steckmuller, who is one of our mentors, that found that simply sitting and singing in a group therapy session for 1 hour improves motor symptoms, including gait, posture, and tremors. And there was a study by Earhart that found that singing improved gait in simple walking tasks. And so given that singing improves simple walking tasks, we hypothesized that it would also improve complex walking tasks in people with Parkinson's. And complex walking is relevant because that's more of the walking that we see in daily life.
So when it comes to recruiting participants for a study, we drew from 4 main sources. First of all, my apologies, sorry. First of all, we drew from our lab's outreach groups as well as our Parkinson's disease registry list. We also drew from the Iowa State University Departmental Registry List and the American Parkinson's Disease Association support groups in the Ames community. We reached out to possible participants via email, phone call, and verbal announcement, and you can see a flyer here on the left side of the screen that we use to advertise our study as well. Some of the inclusion and exclusion criteria that we use to decide which participants can participate in the study. Both groups had to have a score required in the Beck Depression Inventory as well as the Mini Mental State Exam. They also both had to have the ability to walk without an assistive device such as a cane or a walker. Healthy young adult participants would be between the ages of 18 and 35 years old, and for those with Parkinson's disease, between the ages of 55 and 85 years old. Participants with Parkinson's disease had to have no other neurological disorders, and for healthy young adults, they also could not have any neurological disorders whatsoever. Persons with Parkinson's disease had to be on their current Parkinson's disease medication for at least 30 days without changing their regimen, and both groups had to be familiar with the nursery rhyme, row, row, row your boat.
Okay, so demographics for our study included healthy young adults and Parkinson's disease participants. So for our healthy young adults, we had 15 participants, 11 females and 4 males, and the average age for this group was 21.6 years old. And then for our Parkinson's disease participants, we had 4 females and 6 males, and the average age for this group was 74.2 years old. And then our measures for our study, we started with an informed consent document for all participants, and then a Beck Depression Inventory test and mini mental state examination. And then our participants with Parkinson's disease completed a questionnaire and then gave us their disease information, so symptoms, date of diagnosis, and medications.
So for data collection, all of our participants completed 12 walking trials, and then we had 4 different conditions. We had straight walking versus serpentine walking, and then singing versus not singing. This photo is one of our peers in the lab demonstrating what a trial would have looked like. This is serpentine walking, where she would do like a figure 8 motion through the house. So like I said, we had 12 trials total over a 30-foot walkway. Each participant did 3 trials of each condition, and they were in a randomized order. So for the first condition, it was straight overground walking at a preferred pace with no singing. The second condition was again straight walking, but this was with the self-produced auditory cues. That was the singing row, row, row your boat. Third condition was serpentine walking with no singing. And then our last condition was the serpentine walking with singing. And then how did we measure gait? So we measured gait using the APDM opals, which you can see in that image on the right. These are electronic devices that participants wore on their bilateral wrist, feet, and lumbar region. These just went over their clothes. They didn't do any stimulating. All they did was collect data. And so what they collected were spatiotemporal measures during walking. This is cadence, gait speed, stride length, and everything else on this list.
So when analyzing the results, the main thing we looked at was standard deviation for each measurement in each trial. More specifically, the difference in the average variability of movements between an individual's walking trials. In general, especially for Parkinson's disease, less variable is more consistent, which is better. We use 2x2 ANOVAs to statistically test the results. Moving on to the results, the first subset of results, we're looking at comparisons between healthy young adults and persons with Parkinson's disease. To orient you with the graphs a little bit, since you'll see these on other screens in the future, the left graph will always be for the left foot, the right graph for the right foot. The y-axis will be the measurement that we are looking at, and the x-axis has all the conditions listed that we're looking at. Healthy young adults will be represented via the red dots. The red bold dot will be the average variability, and the same for Parkinson's disease, except in the yellow dots. So as we can see from these graphs, using gait speed as an example, we see that persons with Parkinson's disease are more variable than healthy young adults. Additionally, in other measures such as cadence, circumduction, gait speed, and stride length, we see the same pattern. Parkinson's disease makes the participants more variable in their gait cycles. Moving on to the second subset of results, we also have comparisons within the Parkinson's disease group with their singing versus non-singing. So what we see in elevation specifically, which is the maximum height the foot is lifted throughout the gait cycle, and what we see from this graph is that specifically right side elevation during the serpentine walking, which is our complex walking task, we see that singing makes the elevation less variable, which is good. This can prevent fall risk, and that is a very big concern in persons with Parkinson's disease. Additionally, we saw significance in circumduction on the left side during serpentine walking. Again, we saw that circumduction was less variable in singing at a value of 0.1323. This would be a trending significance.
So what do these mean? So stay tuned to see additional results from our other group, but what we found in terms of variability is that people with Parkinson's disease are more variable than healthy young adults in all standard gait parameters. We also found that during serpentine walking, singing decreased variability in right foot elevation and left foot circumduction. These are helpful for fall prevention, especially during complex walking. If we think about it, if a person is walking and they're lifting their foot up a different amount each time they take a step, they're more likely to fall. And stepping over something and visualizing that in your head is actually a clinical strategy to avoid freezing of gait in people with Parkinson's disease, so this just adds on to that. That would be a good thing. Overall, our results show potential for singing to improve complex walking with people with PD by decreasing variability. However, we do note that variability in gait increases with age in general, and Parkinson's disease people are generally older adults. So this is an ongoing study, and in the future we will be looking at whether these results are due to age or due to disease progression.
So quick, some of the limitations of our study. First of all, the length of the walking pathway. As Anna mentioned earlier, it was 30 feet long because of the hallway that we had. And it's possible that a lengthier hallway would better represent the ecological conditions that a person with Parkinson's would see in daily life. Also, the variability of the opals and the small sample size of 10 Parkinson's disease participants would be another variability. Involuntary musical imagery is a big one as well. When we ask the participants not to sing, they may still be singing the music in their head due to singing it previously. Finally, access external stimuli such as distractions. We tried to limit them as much as possible, but of course it's impossible to fully limit them as we were in the hallway as well as a distraction.
So moving forward with our study, we will be collecting more data. Hopefully we will see a greater sample size and more significant differences in our results. And then we plan on collecting data in healthy older adults to age match with our participants with Parkinson's disease to see if our results are really due to Parkinson's disease or age.
So we want to say first and foremost thank you to all of our participants because we wouldn't have all this science without them. And then we would also like to thank our peers at the AMP Lab, which you can see all of them in this photo. And lastly, we want to thank you guys for coming to listen. That is our lab's contact info if you ever need it for any reason. And we'd be happy to take any questions.
Thank you very much for your presentation. We're actually now going to open up the floor for a couple of minutes of questions. I'm also going to invite the next speaker to go on up and further slides. Yeah, if anybody has any questions, we have a little bit of time for that.